get this started. I was hoping to be able to publish this on Facebook Live, but it seems to be not cooperating. Here we go. All right, welcome everyone. It is now 7 o'clock. Welcome to our Q&A with our superintendent. This evening, we are going to pretty much stay on the topic of COVID, since that is our most pressing subject. We do apologize that we can't cover more subjects during this meeting, but we hope that you will be able to get your questions answered. A little bit of instruction on the way this is going to work. Down at the bottom of your screen is a Q&A button. We invite you to use that to ask your questions. Hopefully most of the questions that you are thinking of will be covered in information given prior to opening it up for questions, but we will then answer the questions in the Q&A box as they come in. Please understand that we are expecting well over 500 people, which means that not all the questions may be answered. Let me introduce to you everyone here in our panelists. Needing no introduction, of course, is our superintendent, Mr. Alberto Carvalho. Joining him this evening, we have Chief of Staff from the Office of the Superintendent, Mr. Jamie Torrens. Also joining us this evening, we have Associate Superintendent from the Office of Intergovernmental Affairs, Grants Administration, and Community Engagement, Ms. Araida Mendez-Cartaya. Also joining us this evening from, my apologies, I forgot to write down Ms. Sarah Walkup's title. From the Office of Community Engagement, Ms. Sarah Walkup. And I see we have 3 people with the same name. My apologies. From the Office of School Operations, Administrative Director, Dr. Linda Amica Roberts. And this is so much harder on Zoom when names are not entered correctly on their little boxes. My apologies. From the Office of Human Capital Management, Chief
Ms. West, I'll help you if you like. This is Jim Farns.
Please help me, because all of the names are the same.
Okay, no, we have Ms. Daisy Gonzalez Diego, our Chief Communications Officer, and Mr. Jose Dotras, our Chief Human Capital Officer, and also Ms. Marie Izquierdo, our Chief Academic Officer.
Thank you. All right. So this evening, like I said, if you are invited to enter information on the Q&A questions that you wish to have answered. And I'm going to turn it over now to our superintendent, Mr. Alberto Carvalho.
Thank you very much, Ms. West. It's really a pleasure to be with, in a company of an organization that I revere, that I have partnered with for so many years, and I still take pride in the fact that I believe I'm still the only superintendent to ever have been on the national board of the PTA, and that gives me a great deal of pleasure and honor. So what I hope to do tonight, and again, thank you for the invitation, the opportunity. I'm happy that I have a number of my colleagues with me, for no doubt there'll be some questions whose level of specificity may require their supreme intellect. It also proves that we're not in this alone. This is teamwork, whether we're talking about administrators, support staff, our parents, our teachers. It's teamwork, it's community work. I think it would be an understatement if I were to tell you that our months, our days, our weeks, which feel like years since January, have not been hard. They have been extremely difficult. If we hear that these are unprecedented times one more time, if we hear that these are uncharted waters one more time, we know that. But we have been navigating the support of our community. And I have to say, with the understanding and the patience of our parent community and the zeal and the hard work of teachers and leaders and support staff across the district. What I hope to accomplish today or tonight is really not necessarily take you back to the last quarter of last school year, because we know what happened. You know, we shut down schools. We did it methodically. We did it seamlessly with the support of our community. We employed what we believe were the best practices we had available to us by deploying tools and devices to students. But much has changed since then. Here we are having this meeting at a very important time, since just yesterday, the Commissioner of Education released an executive order, which was jointly announced by the Commissioner and the Governor, specific to the issue that you just mentioned, Sandra, which brings us all here today, which is COVID-19. So let me begin by talking about that important emergency order, which basically lays out a number of elements that I believe are of importance to all of us and interest to all of us. So yesterday, Monday, November 30th, the Commissioner of Education, Richard Corcoran, issued another emergency order, number 2020 EO07. In this order, he basically extends the flexibility that Miami-Dade and all other 66 districts in the state of Florida have benefited from. That means we have benefited from the flexibility of providing local control over parental option decisions, meaning if you are a parent who wants to have your child educated in the schoolhouse model, fine. If you are a parent who wants my school online for whatever reason, that is fine. If I were to take you back a number of weeks, some thought that those options were in peril. They no longer are in peril. They are now a matter of an emergency order published yesterday. Secondly, this important order also establishes a sustained fiscal stability for our school system and the systems across the state. Let me explain what that means. Number one, if you recall, the initial order basically provided some safeguards regarding FTE. We know in this district and across the state, most districts have lost FTE, have lost students. Particularly at the younger grades, there has been a significant loss of students. In our community, for example, despite our wellness checks, knocks at the door, phone calls, we're still missing children. Seems like the entire family has picked up and moved on, moved out of the county perhaps. So the emergency order provides a protection, meaning we are continuing to be funded at a level that is consistent with the expected number of students that were projected last year. That is significant. If this had been lifted, we could be facing a revenue loss as high as $62 million for this year. That would be catastrophic for us. Equally important, the emergency order also fully funds students' education if they are in my school online at the same level as if they are in the actual physical facility. That too was in question just a little while ago. There were some who were advocating perhaps for a lesser level of funding for students who were learning online. We are protected. All students are funded at the same level. But also provides, this emergency order also provides a number of other protections and requirements. Number one, I'm proud to say that this is easy for us to adapt to because this has been our practice for a long time, actually since the new semester began, is any family who wishes to change the modality of learning for their child can do so within a week. You don't have to wait 2 weeks, 3 weeks. Within a week, an accommodation needs to be made. In addition to that, the emergency order, the last thing I'll mention about it, provides for the district to have a responsibility in reaching out to parents of students online who may be regressing significantly, who may be observing, experiencing a significant learning loss beyond the summer, now this school year. The state is basically requiring us to consult with the parents and present to the parents other alternatives to address the rapid learning loss that they may be experiencing. So that is in essence the emergency order. We will be providing a lot more information. It is my goal to send a letter to all parents. We'll send it to the PTA as well for our community to be aware of what's involved in this very important emergency order. So we are thankful that the emergency order is here. We're still requesting additional support, particularly from the federal government, to help us cover the costs associated with coronavirus, to help sustain the level of instruction we are sustaining, to protect our highly qualified workforce, to provide additional opportunities for parents and students alike, and to continue the level of sanitization and PPE distribution that we have embarked on. I want to, at this point, to remind our community of parents that I'm a true believer in local control. This emergency order basically states that schools are to stay open no matter what. We will continue to make decisions that are in the best interest of our community based on local information as verified and recommended and agreed to by local health experts in consultation, obviously, with the Department of Health here locally and in Tallahassee. And so much do I believe in what I just said that we have reconvened the ad hoc public health and medical expert task force. And we're going to hold a joint meeting with our school board and our medical experts this December 7th at 1 p.m. The meeting will be streamed live, and I believe it will be at a critical importance as we continue to observe, obviously, positivity rates for coronavirus growing with each passing day. In fact, today it is at 9.81, a little bit lower than it was yesterday. Yesterday actually passed 10%. We're running a 14-day average now around 8%. That's not where we would hope to be. And certainly we're concerned that now in the aftermath of Thanksgiving and people coming together, despite the admonishment, despite the warnings that we may see still an increase in the positivity rates in our community. With that said, the positivity rates in our school system, when you look at the total student body count and employees, are a fraction of what they are in the community. So a little bit more conversation about, I think, some of the things that I've heard the most, questions from parents, emails that I receive, even posts on social media. I want to talk a little bit about contact tracing and the protocols. A lot of people have questions about that. I want to talk a little bit about also what it takes to actually confirm a case. How is the information uploaded and why the delay that we've talked time and time again on the dashboard and why that is important, but also the criteria for the closure of a classroom or a closure of schools. Since we have closed one senior high school, but also an elementary school of different sizes for different reasons and at different circumstances. And then finally, just talk a little bit about attendance during COVID-19. And I promise you I won't take but maybe 10, maybe 15 minutes to cover it, leaving the rest of the time for questions and answers. So beginning with obviously the importance of contact tracing. I want to be clear about one thing. We are not responsible. So Miami-Dade is not the unique entity that conducts contact tracing. Contact tracing is basically investigation of who's had contact with someone who is symptomatic, who is COVID positive, to obviously curtail, reduce, eliminate exposure and contamination. So we have developed and implemented a comprehensive process to address positive cases of corona, which includes school investigation and mitigation strategies for the protection, obviously, of our students and our employees and our parents, consequently. The district is also moving, if parents don't know, you need to know, towards a contactless student ID system for both cafeteria service in schools where that is possible, as well as transportation. We're well on our way. We have been able to strengthen our response in our community by purchasing thermometers, and we have distributed in excess of 60,000 thermometers to parents, infrared thermometers. We have an additional 60,000 are going to be distributed beginning next week, and then another 60,000 later on in December. Why is that important? Because it is a good measure to take before sending your child to school, or even if your child is on MSO, to take their temperature daily on a regular basis. We have expanded dramatically nursing and medical personnel support to all schools. Every single school has either a nurse, an EMT, a paramedic on assignment at the school. And we are collaborating with agencies to support staffing needs wherever they may be in our schools. Now, in the event, and I think this is one of the critical questions that I get asked all the time, in the event that a student or a staff member tests positive for coronavirus, we as a school system follow two different paths of investigation. First, if it is a self-reported case, and I have to say, to report a case, parents should always immediately contact the child's school. After school hours and on weekends, they can call 305-995-3000. We have employees who are ready to take the call and take the information, because the expediency of getting information and reacting to it is critical. Now, MDCPS employees, our own employees, should always self-report cases directly to their supervisor. That is the mandate. Once a parent or a guardian or an employee reports a positive case to a principal or a site administrator, the principal or that administrator immediately notifies the district school health officer, we call the DSHO, and initiates the in-school investigation. That's where the contact tracing actually begins. Then the district school health officer reports the case to the Florida Department of Health, actually the local Department of Health, but they are a subdivision of the state's Department of Health, to both collaborate and to support the school principal with the in-school site contact investigation and tracing. Now, if the Department of Health itself confirms a case, when they confirm a case, they report it to our district health school office. In this case, our office then notifies the school principal of the confirmed case. The principal or administrator on site then initiates the in-school contact investigation and tracing. Now, both types of reporting, whether it is self-reported or if the Department of Health reports it to us, then lead to the following outcomes or steps. Number one, our health department, the state's health department, work together to immediately implement mitigation strategies based on the in-school investigation, the contact tracing procedures, which always include a review of the student's schedule or the employee's schedule, whether the student rode the bus, whether they participated in extracurricular activities or sports, if there are other members of the household, parent or child, at other district schools or sites that may need to be investigated as well. That's a critical set of steps. The next thing we do always is we fully sanitize the building, inclusive of electrostatic sanitization. The school then begins the notification process to anyone at the school site that is identified as having been in close contact with the individual who tested positive for coronavirus. The entire school community, including parents, employees, are notified via telephone and or email. it is imperative, and I'm asking you, Sandra, and the PTA to help me with this. It is imperative that parents keep their contact information up to date, so the schools can ensure that the information is readily passed on to them. Now, those individuals who had close contact with a student or employee who tested positive for COVID-19 are then instructed to quarantine for 14 days, even if they do not develop symptoms. And I often hear from parents, but look, my child doesn't have symptoms. I can send him to school. Well, that is not the CDC guideline or recommendation. Once the quarantine period is over, they may return to school. Equally important, siblings of these individuals are not required to quarantine unless they too were in contact with the original individual who tested positive for COVID-19, or if they develop symptoms. That's critically important. There's sometimes some confusion about this element. And by the way, we included all of this in our most frequently asked question document that we have made available to everyone. Now, a student who has tested positive for coronavirus is required to quarantine until the Department of Health notifies the school system that the student is clear to return to school. This is critically important. We are not the authorizing entity that allows the student who actually had COVID-19 to return to the school. The Department of Health clears the child, then communication is established with the school system, then the school system notifies the principal, who then will notify the student's parent or guardian. While schools or classrooms are closed, obviously, students can and will participate in My School Online. Although in some cases, being perfectly honest, including certain choice and magnet courses, certain alternative academic arrangements may be difficult to make. So we create an alternative path for those students. Let me speak a little bit about the role of the isolation room, because I get questions about it all the time in a school. If a student becomes ill, if a student has any type of symptom that is resembling the symptoms of coronavirus while at school, that student is isolated, separated from the other students and staff, and is placed in an area called or identified as an isolation room. It is staffed, it is monitored. Immediately, the district reaches out to the parents, and if needed, the student's guardian via the emergency contact information. Parents are then asked to pick up the child and obviously seek medical consultation for the child. Let me talk a little bit about the criteria for school closures. And I know that there's been a certain degree of apprehension, maybe confusion, a certain degree of misinformation as to what the criteria is. And I want to be very clear. In many cases, the decision to close a classroom or a school is the result of the close contact investigation. However, these determinations, there's no magic bullet. There isn't a simple metric that we use or we can use. These determinations are made on an individual school by school basis due to a number of factors that potentially impact the final decision, such as the number of COVID-19 positive cases of students and staff, the mobility of the staff, if we're talking about a staff member who was infected, the mobility of that individual throughout the school. Was he a classroom teacher, or was she an itinerant teacher or a support staff member that had multiple contacts with other employees or students? Our own ability to sanitize the school prior to the return of students and staff. The cases that are linked within the same school and the ability to notify those impacted based on the time of day. Sometimes we receive information too late in the day to be effective at reaching out to every single entity. So it may not be that it is an extremely large case of number of students that would need to be quarantined. It may just be the time of day or night that we receive, confirm the information, may not allow us to go into the school and sanitize the school. Therefore, you may have to close the school. That was, by the way, the case that we dealt with at Mast and at the elementary school. A little bit about the dashboard. Look, I know the dashboard is a powerful tool. but I'm afraid that some people are using, with the best of intentions, a dashboard in an incorrect manner. We began reporting cases on the dashboard on October 5th when students returned to in-person learning. Only confirmed cases among students and employees who are physically in school are actually reported on the dashboard. So that allays some confusion out there. Some parents have children on MSO who would go to a certain school, but they say, my school was not there, but my child has it. Well, if you are on MSO, then your data is not going to enter the dashboard. The dashboard reflects data for students and employees who are physically in school. The dashboard is updated daily. The cases of students who test positive for coronavirus are entered in a dashboard only after being confirmed by the Department of Health. However, for employees, because they are our employees, and they can present verification of a positive test, that information is updated upon confirmation. It is critically important to know that sometimes the time period from a child developing symptoms and actually being tested, and the parents may know that the child has tested positive, but that data actually appearing on the dashboard may take 2, 3, 4 days. That depends on the volume of work that the Department of Health is dealing with. So we are at their mercy to update the information, but as soon as we have the data, it is uploaded on the dashboard. Also, the school site case numbers reflected on the dashboard are provided by principals and vetted by our own district health office to ensure that data quality is maintained. This too adds a little bit of a lag in terms of updating the information. So the data entry is separate and apart from the immediate mitigation and contact tracing procedures that I described a little while ago. And people need to understand this. We don't wait for the Department of Health to confirm a case for us to call parents about a presumptive case. So we begin the calls, we begin the outreach to the community of parents and to our employees before the information ever goes up on the dashboard, because we do not want to waste a single minute when we could utilize that time to actually provide information to our parents. So families, parents, please, and employees, do not rely on the dashboard to learn about cases in your school or school site. You will get a call, you will be notified, or if you're an employee and you have the information, you report it, you self-report it to the workplace. Lastly, I really want to talk a little bit about attendance. Look, it's not a mystery across the country where we're dealing with a significant issue. Actually, 2 issues. We are observing a significant decrease in attendance levels compared to last year at this time. And amazingly, the level of disengagement is higher for students online than it is for students in the schoolhouse model. We believe that's a function of supervision. It's a function of parents' demands associated with workplace. But we're really experiencing a crisis-like condition when it comes to student attendance and engagement. So parents and students obviously are responsible for attendance during the days and hours that school is in session in both the MSO and schoolhouse models. It is critical for the students who are enrolled in MSO online to log into live sessions with their teachers, keep their cameras on all the time. In fact, that's been our policy. Broward just adopted a new policy last week requiring the same, and attend online classes as scheduled. Secondly, it is very important for parents to understand that any absence, whether schoolhouse or MSO, must be reported to the student's homeschool by the parent, the guardian, no later than 5 days from the date of the absence. And to report an absence during the time a student is enrolled online in MSO, parents must submit a statement of the cause for such absence via email directly to their home school. Critically important. But I want to reemphasize as I close. We have a larger percentage of students who are absent at this point in the school year, 10 or more days in the first grading period alone of 2021 compared to 1920. Whether you are an MSO student or a schoolhouse student, if you're not there, you're not learning. If you're not engaged, you're not learning. By the way, this is true across all grade levels, K through 12, but it is especially more pronounced, more noticeable in grades 6 through 10. So it's really more of a secondary phenomenon, a middle and a senior high school. So we are launching a very aggressive number of attendance strategies, intervention strategies, wellness checks with, we've been doing this, but we are going to increase it, social workers and visiting teachers, and even our police department, if need be, knocking on doors to urge parents, number one, to reconnect with our school system. Secondly, to provide the assistance, the additional assistance these students may need. We're also implementing a number of new strategies to help schools improve student attendance through an awareness campaign, through a massive marketing campaign. We want to reconnect with the students who are critically absent, but we also want to recapture the students who disappeared. And there are about 1,700 students that since the beginning of the school year have had no contact. These are called the no-show students. By the way, the same is true across the state. Broward, Palm Beach, Hillsborough County dealing with the same type of issue. But then we have about 6,000 students who are critically truant from our schools that have accrued 10 or more absences, and that cannot continue. So we're going to do all that we can to get these students back. It is our critical priority. So with that said, we don't know what we don't know, Sandra, and I believe that I'll pass it on to you to begin to entertain the questions, and I know for a fact that I will learn myself through the process. Look, we're not perfect, and not everything we do is perfect. I know that. We're doing it at a time when nobody has definitive or finite answers for anything. The data keeps changing, scientific information keeps changing, what the real challenges, dilemmas, trials are keeps changing. But I can tell you one thing, I am the eternal optimist. And I know now with 3 companies that have now developed vaccines that the light at the end of the tunnel is in fact a very strong and hopeful light. We're beginning to get information about the criteria for immunization for COVID-19. As we have access to that information, we will pass it on to the parents. And now it is my pleasure to turn it over to you, Sandra, for the questions.
Thank you, Mr. Carvalho. One of the questions that keeps coming up is they are asking about what will happen if we do transition to phase 3?
Well, that is a very, very good question. So let me just tell you that the state as a whole has transitioned to phase 3. Presumably, we are part of the state, and we have requested of the Department of Education technical assistance and guidance, which the Department of Education has promised would come to us sometime before Thanksgiving. We have not received it yet. So we are waiting on the technical guidance from the state specific to phase 3 in schools across the state, since the governor has in essence transitioned the state into stage 3. Now, let's remember that while we were in phase 1, it took a long time to transition to phase 2, but we went from phase 2 to phase 3 as a state just in a matter of weeks. So we are waiting on guidance from the state. We have not changed the protocols in Miami-Dade at this point. So the social distancing is still in place, whether it is in schools or transporting students or in the way we feed students. We have not altered our protocols. Our protocols are still consistent with phase 2, even though the state has transitioned to phase 3. As soon as we have the guidance from the state specific to phase 3 as applicable to schools, we'll make it available to the community at large, beginning with the PTA.
Thank you. Another question that has been very frequent is concerns testing. Specifically FSA testing and how that, and whether MSO students must come into the building to execute that examination.
Right. You gave me a perfect segue to actually address two types of testing. So the first one, not to do with academic testing. Let me speak about critically important information regarding COVID-19. This has been a priority of our school board, obviously, and through board action, the board actually led and approved the creation of testing sites for employees. We have 3 testing sites where we administer free COVID-19 tests, actually both types. In addition to that, we, as of 2 weeks ago, launched a great partnership with the University of Miami Pediatrics for the free testing of students via a mobile unit provided at no cost to the school system for the benefit of students. We are now with a testing capacity of 300 students per day. We hope to dramatically increase that, for I believe that the more we test, the more we know, the better we can prevent. Now, let's move on to your question, which deals with academic assessment. And I was not asked this, that was not your question, but let me be absolutely clear on one issue. Our priority now should be the safety, the security, the health of our students and our employees. Secondly, our priority needs to continue to be the education of these children, all children, with special attention to the most fragile populations, English language learners, students in poverty, those who are home insecure and food insecure, students with disabilities, students who are in foster care, homeless children, children whose parents want them home, but they have to work 2-3 jobs. That's my biggest priority. So what I'm trying to say is that I certainly hope that we get to a point where the state recognizes that in as much as we need an accountability system, and I believe in accountability, really counting accountability against teachers, students, and schools, considering the trauma and what this crisis has created, probably is not the best idea this year. I believe in the students being tested for us to know where they are, but we test them anyway. We have formative assessment protocols that tell us where children are. That's how we know that some are regressing, that some have learned part of that, have lost part of their learning. But we are concerned, as you asked, about bringing all students into the schoolhouse to test them. In fact, we had a cabinet meeting today, and we were addressing that very same issue. At this point, the state is providing no flexibility as far as assessment. I am putting together a communication to the state requesting a number of concessions, and these are conversations that we've had with entities statewide. At the very least, we need a broader, more expanded testing window so that we do not create congestion in schools. Secondly, I believe that forcing every child to test on a computer, since the computers are currently assigned to the students, is going to require a gigantic endeavor in terms of retrieving the devices, sanitizing them, actually preparing them internally for the assessment itself. We need the state to understand that that is a difficult process to accomplish at this time. And lastly, the state can be more creative. We could rely more on paper and pencil assessments this time around, allowing a staggering of students through a greater time for the testing process. But count on me to continue to advocate with the state that in times of crisis, the safety, security, health of our students ought to take priority. The teaching ought to take priority, and we ought to not obsess over testing requirements during a pandemic crisis.
Thank you. Another question that has come up is, my apologies. The little boxes tend to move over each other in the Zoom. What reporting mechanism is there if a parent or a staff member has a concern about COVID policies being followed? We have a mechanism for reporting dirty restrooms.
Right.
How do the parents or the staff report possible violations of CDC and COVID guidelines?
Very, very good question. So number one, I'm a believer that, you know, if it's a school site case, my strong encouragement would be directly to the principal of the school. However, if the person does not feel comfortable, the region office should be contacted, and we can make those telephone numbers available. So if it is a school site violation, school principal, school administration, or if the person feels more comfortable, the region office under the supervision of region superintendents. In addition to that, if the person still doesn't feel comfortable, please contact my office. I want to know. And I said this publicly at a board meeting recently. In addition to that, the hotline, the 305-995-3000, is also a number that can be used to anonymously report violations of the protocols in place at schools. Or, by the way, not just schools. It's a school or any workplace within Miami-Dade County Public Schools. We have protocols. I think people know the protocols. We ought to be following them. You keep hearing me on TV interviews talking about the fact that if we want to keep schools open, the community needs to get it together and wear masks, maintain social distance, right? Not congregate. That's how you reduce positivity rate in the community. So if I'm saying that out there, I expect the protocols that we have in place in our school system to be followed, period. I myself, before entering this building, I do my own self-assessment, health assessment, and I get the little green thumb, and I wear a mask. Sometimes I forget as I'm walking out of the office, I quickly come back in to put my mask back on, even though everybody around me is wearing a mask. So these are expectations that we cannot relax on.
Thank you. Since there's a possibility of MSO students wanting to attend physical school, is there a maximum cap for classes or the school building?
So very good question. That's why we're in such desperate need for the guidance from the state specific to phase 3. So at this point, I'm sure you know that schools and students who attend schools physically, schools are at no more than a 75% capacity threshold. And that allows for a 3 foot, 1 inch distance between the students themselves in the classrooms. We still have some wiggle room, but that is currently the protocol. We are examining, based on the commissioner's emergency order published yesterday, the implications on school capacity and any necessary tweaks to the threshold or the social distancing requirements in schools. We are obviously going to be depending on these conversations we have with parents, these communications, which will be school-based. So there will be initiated at the school with every single parent of children who are in MSO, and determine what the critical demand is for us to be able to make adjustments. But look, I think the guidelines under the CDC are quite compelling. We're also waiting on revised guidelines from CDC. We've been told that CDC is going to rewrite its school protocol guidelines and advice. And as soon as we have those, we'll be providing them to the community at large. But at this point, we have not, nor are we changing the guidelines. The social distancing is still the same. The threshold capacity is still the same, 75%. And common spaces, areas like the cafeteria, we have not changed the protocols. 1 student per table, no less than 6 feet apart because obviously to eat, they have to take their masks off. So we have not come off any one of those guidelines or those requirements. It may be, and I need to be honest, it may come a point where the demand for schoolhouse model by parents reaches a point where under new revised guidelines, we may need to adopt something different. But at this point, we continue to follow the established protocols and guidelines. They are reflected in our reopening of schools manual and reflected in the most frequently asked question document.
As we plan for the events for the graduating class of 2021, do we have any outlook as to whether we're going to have to do this as a virtual event?
Well, yeah, I really, I'm still waiting on the appropriate time to fulfill my promise to last year's graduating class, which was, I promised a virtual graduation, and when conditions allowed it, a celebration that would take place physically. So conditions obviously at this point do not allow it yet. I think it's too early for me to opine on that. I think we need to continue to examine conditions, seek the advice of our experts, which we are meeting with, as I said, on the 7th. And that's going to be one topic of conversation with them. But I think it's too early at this point to provide any insight on how we will be conducting graduations. You led me to another thought, and I did see it because I'm monitoring the Q&A online simultaneously. I cannot bring any news yet to graduating students regarding, or if you're in 11th grade, 12th grade, regarding end of course assessments. At this point, the information we have from the state is that the state intends to carry out all of the assessments pursuant to statute. That includes the end of year assessment and obviously the FSAs. Should something change, we will obviously notify the parent community. I do not expect to see a repeat of last year based on conversations with Tallahassee officials. So I believe that for graduation this year, I don't think that the graduation requirements except GPA and course completion will be waived. So we need to make sure that parents continue to urge, particularly their high school students, to complete their coursework, to keep their GPA up, and to expect, unless the state changes something, the end of course assessment to be fulfilled prior to graduation.
And as a parent of the class of 2020, we are still awaiting that promise to be kept.
You know me, promise may, promise kept. I just need a little help from science.
So another question that's being asked is, well, we talked about the 75% brick and mortar limit right now. Is there a plan for when they might be able to exceed that?
We have a plan to not exceed that. We have a plan to pivot towards a more aggressive, I shouldn't say aggressive, toward a reality where a higher number of students or parents opt for the schoolhouse model. But we're not ready to discuss it or make any pronouncement about it until we receive the technical assistance from the state that's been promised to us. For a couple of reasons. Number one, we don't want to miscommunicate. We do not want to say something based on what we believe would be the right approach and then be contradicted by the state. So it is most prudent for us to await the state's guidance on phase 3, which, trust me, will address the state's expectations and the state's protocols. But again, I believe, as I said early on, that when it comes to the safety, the health, the well-being of our students and those who teach them and support them, those decisions ought to be made at the local level. based on local conditions and exercising the best use of the protocols and resources that we have. So that's my way of saying we are awaiting the guidance from Tallahassee, but I hope that that guidance comports and follows the best medical advice that our local experts will provide to us, because we don't want to be in a position where one set of guidelines conflicts with what our medical and public health community here locally advises and encourages us to do.
Thank you. There are several questions asking for a reiteration of the contact tracing protocols.
Okay, so I did it once. Maybe Mr. Torrens, are you on?
Yes, sir.
All right. Do you want to take us through just the two scenarios, student, employee, self-reported versus reporting through the Department of Health? So the contact tracing protocols.
Yes, certainly. Thank you for the question. The superintendent mentioned when it's an employee, the result is assumed to be posted, and it's posted to our website immediately, regardless of whether it's an employee or a student. As far as the mitigation strategies and the contact tracing, it really doesn't vary significantly. When an individual is tested positive, our school health office works collaboratively with the health department. We collect the information at the school related to the contacts that the student may have had. We have a matrix that we follow, which shows which students and which other staff members either the student or the staff member had contact with based on class schedules, bus schedules, and after-school activities. And then that information results in a list of contacts that the student or the adult may have had in the given day, or the last day that they were present at the school. Those individuals are then contacted by the health department and advised that they may have been in contact with a
Mr. Torrens, you've gone silent.
Yeah, I'm sorry. The typical protocol would be the individuals would be contacted by the health department. Anybody that had a contact with the adult or the child in question that's positive, and they would be advised typically to quarantine for 14 days at that point. So this is a collaboration between our schools, our principals, our staff, and our school health office, collecting information, providing that, and working collaboratively with the health department. We actually have individuals from the Miami-Dade Health Department in our offices to eliminate any delays in obtaining verification. But essentially, that would be the process. Those individuals would be contacted, as the superintendent mentioned, and there would typically be a school-wide message sent also that individuals that have had contact with the positive person have been contacted, and that proper sanitization protocols have been implemented, which would be, the class. In the case of an elementary school, typically it's maybe one classroom. If the students are in a cohort. In the case of a secondary school, it becomes more complicated because students have multiple classes on any given day. So the isolation of that student and the quarantine of a larger group of students and faculty is more likely.
Two follow-up questions to that, Mr. Torrens. What number should the parent call if they've received a positive test result on a weekend?
Yes, on the weekend, typically we ask that they contact the school. If they don't have access to the principal, obviously, or a staff member of the school on the weekend, we ask that they call 995-3000. The individual, this is our 24-hour help desk, which is typically for our emergency operations. They will take the information of the individual calling, and they will contact an administrator at the school or the work location, let them know, and with that administrator, that principal, would follow up with the parent or the employee.
Okay, thank you, Mr. Torrens. And one last follow-up question. If a positive student has siblings in the school, are they also required to quarantine?
If the student that tests positive has siblings, yes, those siblings would quarantine as well because they have contact outside the school. The more common question that we get is if a child has been asked to quarantine because they came in contact with a student or an adult in their class, do other siblings that have not had contact need to quarantine? The answer to that is no. So it's a bit of a confusing question sometimes. So I wanted to address it from both angles because we have gotten both those questions.
Thank you very much. And I
you.
believe we have now covered that subject. Mr. Carvalho, another question here is, I'm scrolling through all of the ones. We did reiterate the number that's been asked several times, 305-995-3000 is the number you need to call if you have questions, concerns, or weekend COVID results that you need to report and you don't have access to your principal. So another question that's being asked is when a vaccine has been identified, will this vaccine most likely become a required vaccine for school attendance?
So that is a question that we have discussed among staff. I think it's too early to tell. It's a topic of conversation because people are asking that I'm going to bring up at our medical and public health expert meeting on the 7th. But I can tell you one thing, and this is just my opinion. As a nation, just today, there was the first conversation, set of decisions as to the priority distribution of vaccines. And it was decided medical personnel and individuals who live basically in retirement facilities. And I think there are logical reasons as to why those decisions. I think there's going to be a significant process before we get to mandatory vaccination for COVID for students, because there is such a backlog of entities, and at the same time, at least for the next, based on the experts, 2 to 3 to 4 months, such an extreme need for the units themselves. I do believe that once there is an ample supply, and once further testing is completed, and there are now, I believe, 3 different companies that are involved in a production of, or different levels of, actually the same level of the testing phase, and ready to go out with the emergency approval and actual distribution. I believe that more than likely, and based on some conversations I've had with health officials, that guidance on immunization for coronavirus for children may not be a reality until the next school year. So we will go maybe through the summer months. Will be an optional thing on the part of parents, families, but not mandatory. I believe that if it ever becomes mandatory, it will not be this school year. It would be at the earliest for the following school year. And again, this is based on private conversations I've had with medical experts, just on a basis of what's known at this point nationally. You know that there is a significant process that the medical community goes through before it declares through a number of different agencies the required immunizations, by what age, what they ought to be for school registration. The difference here is COVID-19 went from 0 to 100 so quickly, right? Went from being a headline in China in January to closing down basically the world, well into the summer of 2020. So a lot to be learned about it yet. So I cannot tell you. It's a good question. It's one that I keep having conversations about, but it's not one that I can respond to. But what I can tell you is the likelihood that there would be any mandatory immunization for COVID-19 that would be applicable this year is really very, very, very extremely remote.
Thank you. Well, I see that we have now reached the 8 o'clock hour. An hour is hardly enough time to talk about this very extensive subject. We have attempted to answer as many questions as we can.
Sandra, do you want another 5 minutes, a bonus round? Try to get a couple more questions in. It's up to you. I know people starts and ends on time.
We do like our timing clock. Yes, I think that we can go ahead and do another 5 minutes. Here's one question that we have not talked about. Now that the CDC has changed its guidelines for quarantine from 10 days or 7 days, will MDCPS change their guidelines as well?
So we are, I would ask Mr. Torrance to chime in, but look, as I said earlier, we are reluctant to change the protocols at this point until we see the technical guidance from Tallahassee. We really want, there are three significant sources of information, right? Certainly there's the CDC, and then there's the state health department, which I put a / local health department, because the local health department is a subdivision of the state health department, so the health department, and then in our case, our medical advisors. And all of that with a backdrop of national and international peer-reviewed research. So we are careful about changing protocols, and I'm speaking specifically about relaxing protocols without having all the information in. And right now, we have one expert meeting coming up on the 7th. We have still the guidance from the state that's going to come to us. So I am not one who wants to rush a change of the protocols in place until we know what all these different sources of information will bring to us. Mr. Torrance?
Yes, sir, I agree. That's one of the questions we'll be discussing with our medical experts. And there has been some variation in guidance, but I think overall, the 14-day is still seen as the most cautious approach, being that there are a lot of variables that occur during that time, and the onset of symptoms and the cases that are many times are asymptomatic. So we will, reevaluate this. As the superintendent mentioned, we will be meeting with our medical experts next week. And we will discuss any changes in guidance and give parents and our community a proper time to adapt to any potential changes.
Thank you.
Sandra, I'm sorry. Sandra, I see one question that I see it appear a couple of times, and I think I want to address it, if I may. There's still a degree of confusion. So regarding the notification and the permission for students to return to school. And I would ask Mr. Torrance again to chime in. If a child has tested positive, as I said, the Department of Health is actually the responsible entity that provides the clearance for the child to return. That clearance, however, goes through the school. Our school system is notified. Our district office for school health is notified. Then information is passed on to the principal. The principal contacts the parent. The child can come back because it's been verified through the Department of Health. However, that is not to be confused. And I think there's some confusion out there in the community for whatever reason, even though I think we reflected this in our FAQ document. If a student was quarantined, but is not positive, but was quarantined, there is no need for any documentation or verification from anyone. Once the quarantine period has expired, that child is not only expected, is required to come back to school. So that's critically important for people to know. You want to add something to this, Jim?
No, that's an excellent point. And the only, obviously, the only variant to that would be if during the course of the quarantine, the child develops symptoms or has any other condition that may lead to testing of that child. But if the child or adult that is quarantined and does not develop any symptoms or has any other issue, they are expected to return either to work or to school at the end of the quarantine period.
And I'll take another one that I see here, keeps coming up. So again, I spoke, you asked me, Sandra, the question, if there are protocols, if someone's observed in a workplace, school or not following the protocols, who can I approach? And I said, if it's in the school administration principal, if you don't feel comfortable, and I think you understand why I'm saying that, if you don't feel comfortable, then the region. If you don't feel comfortable, call my office. Or you can always call 305-995-3000 and leave the information anonymously. But I want to be clear because somebody's asking, what are the consequences? Well, and they're speaking specifically about staff. Look, these are protocols, and the contract, whether we're talking about teachers or other employees, provides for consequences associated with professional responsibilities. So if you don't follow the protocols, is a breach of professional responsibility, and that's just not acceptable. So the consequences could be obviously a warning, a letter for the record, and it could escalate from that point on. But at this point, at least I'm not aware of that type of escalation. I know that there have been at times lapses, and they are corrected. But I need to know if there are reoccurrences in a specific school, a specific site involving a specific person. I certainly am interested in that.
Thank you. And I see we will go as long as you wish to go, Mr. Superintendent, but it is 8:07.
Yeah, I will tell you what, we'll go to 8:15 and then we will, based on a comment that I saw here, said, this is great, we ought to do it more often. I agree. And
absolutely.
I want to ask Ida to actually meet with you, Sandra, and develop a protocol for us to have this type of engagement periodically. I think it's very helpful, very useful.
Absolutely, Mr. Superintendent, we sure will. One of the questions that I see here is concerning the national order to discontinue, well, I believe that lunch is free through December 31st. Mm-hmm. Do you believe that that might be extended?
I have no way of predicting the future, but I can tell you one thing. Number one, I do believe that there will be an extension of that important provision, which is critically important to us because it relaxes the guidelines, allows us to serve meals to all children, allows us to serve meals in a more flexible way. That needs to continue. And I am fairly confident that as we transition into January, the guarantee will be even stronger.
And this is something that we all can take part in. If we feel that this is important, we need to let our legislators know.
Absolutely. And this is one where it's our congressional delegation needs to hear from our parent community. I think they are overwhelmingly supportive of this flexibility. I can tell you that we need to continue to feed kids. Food insecurity is real. We're doing our very best. And with that said, we need to feed more kids than the number we're currently feeding. And that's an issue. So yes, count on me to support your efforts and support our efforts as we continue to advocate, particularly with our congressional delegation, for that type of flexibility. Just like we need flexibility when it comes to technology purchases, E-rate flexibility. I mean, there are antiquated policies that really handcuff our ability to do more for our students, for our parents, and for our teachers.
Well, you
There's
just mentioned technology. That's
question.
another question I see often.
There's another question that just came in. I said it at the beginning, but I'll say it again. And the question is, will this new legislation, which is, I believe, specific to the emergency order, allow students to stay MSO all year? And the answer is yes. So this latest emergency order guarantees the funding and guarantees the option for the rest of the year. It does provide also, as I said earlier, that the district needs to communicate with parents of children who have regressed, who have experienced a significant learning loss, and speak with the parents about better ways of teaching the child. If the issue is supervision, if the issue is level of engagement. And we're going to do that in an expedited way. We've been doing it already, but the state is now turning that into a requirement. So yes, students who are on MSO are safe for the rest of the year. The funding is there to protect that modality. And I do not think, actually, I can almost provide an assurance that that's a provision that the state will not go back on, that this is a pretty strong assurance for the rest of the year.
Now, there seems to be 2 or 3 inquiries about technology needs of students that still continue.
On MSO, so so we've seen something very interesting. We had surveyed parents, right, about the needs for technology. And we gave out all the technology that was requested of us prior to closing out last school year. We went into the summer, we made the decision, I believe the right decision, to keep the devices in the hands of students with the connectivity. When we opened this year, again, we did this time school-specific surveys. But then what we saw is when the community began to reopen, and I believe a function, and we know this anecdotally and through parent information, parents started going back to work or were working from home using their own computers, and we saw a significant increase again in requests for computers. And then what we saw was breakdowns. So older models breaking down, replacement. Then we also saw that neighbors of kids who are now getting the next generation, the latest computer, were saying, I want one of those. And I can tell you that we have acquired, and I don't know if either Marie or Ron, somebody, we have acquired in excess of an additional, I believe, 25,000 devices. The vast majority of them have been delivered and we've provided them to students. We are right now, and this is a data point that we track, every time we have a cabinet meeting, we track the number of requests. That doesn't mean that the child did not have a device, the number of requests. And we went from thousands that required a refurbishment to now just on a weekly basis, maybe dealing with 100 or 200 students requesting a device or requesting a replacement for a device. We're going to continue to address those. Again, that too is an issue, can be reported to 305-995-3000, but the best way is to contact your child's school. Contact your child's school. If you do not get a response, which I'm sure you will, escalate it to the region, but you can always call 305-995-3000 at any time to provide that information or request.
Sandra, if I may follow up on the earlier question about the revised guidance, there is one caveat with that, and it is if a child is quarantined, if they do revise this to a shorter time frame, it would require a negative test prior to returning before the 14 days. So the 14 days will probably still be in effect, But the consideration right now is if it is shortened, it would require that an individual that's quarantined that now wouldn't require a test after 14 days would probably need to be tested before returning earlier. So just thought I'd add that.
And Sandra, I may have misspoken earlier. The fact that Mr. Torrance just said something reminded me. The free meal program for this school year, it is safe. So for this school year, we're in the green zone. There are no issues. I believe that after January, we will see some amplified flexibility when it comes to the breakfast and lunch program that's federally supported. But for this year, the protocols we have in place, the safeguards will not change.
Thank you. Well, it is now 8:15. I want to thank everyone for joining us this evening. Thank you, Mr. Superintendent. We will definitely follow up with your cabinet to schedule future opportunities for you to be able to engage with our community. I want to thank the cabinet for diligently trying to answer as many questions as they can. I know that the attendees cannot see, but there were well over 100 questions entered tonight, and we could not get to all of them in the time allotted. So please do continue. The email address questions@mdccpta.net is still open, and we will definitely pass anything that comes through there along to the superintendent's office so that they can address those questions. Thank you to everyone. And I'm smiling because during this meeting, I actually received a contact tracing phone call from my own school. I know that they are doing their best to make sure that we stay safe. Both in school and out.
Well, thank you so much once again. God bless you all. Have a great evening. And again, if you pass on the questions that were submitted to you to us, it would be our pleasure to provide you with all the answers.
Absolutely. The one question that I just wanted to point out is someone asked, how can they watch any portion of this, this webinar that they might have missed? We did stream it to Facebook Live, and it will be available on Facebook after this meeting is over. The link was provided in the chat box to all attendees. Thank you so much.
Thank you.
And everyone have a great evening.